Soy una mujer que llora, soy una mujer que habla, soy una mujer que da la vida. Soy una mujer que golpea, soy una mujer espiritual, soy una mujer que grita. Hay en la noche un grito se escucha lejano. Cuentan al sur, es la voz del silencio. En esta mar hay un lago encerrado, porque una mujer defendió su derecho. De la montaña se escucha la voz de un rayo, es el relámpago claro de la verdad. En esta vida santa que nadie perdona nada, pero si una mujer pelea por su dignidad.
No action to be taken. Anytime you're ready to start, Judge.
And Councilmember Kelly's on as well.
Councilmember Kelly's with us.
And Mayor, I just want to say, I'm so sorry to hear about your injury, and I hope you recover soon.
I appreciate that. I earned mega dad points, Bridget.
That's what I heard. Big dad cred.
Mayor, I'm on screen here for the moment.
I can see you, Kathy. Thank you.
Great.
Do I hear from Mackenzie?
The meeting of the Travis County Commissioners Court. It's October 12th, 2021, and it's 9:09 a.m. We're meeting here at 700 Lavaca. And Mayor Adler, I'll pass it over to you to start your meeting.
Judge, thank you. We'll go ahead and convene the city council portion of the joint meeting today, Tuesday, October 12th, 2021. The time is 9:10. We are shy one member for a quorum, so we can't take any action, but we're ready to start listening to the report.
Thank you. So I'll call to order the joint meeting of the Commissioners, Travis County Commissioners Court and the Austin City Council, and I will hand it over to Dr. Welks for a briefing.
Good morning, everyone. Seems like it's been a long time since we've seen one another. Good news is that our 7-day moving average for hospitalizations has decreased. Was 28 on the 4th of October, and it's down to 19 as of yesterday. If I could get the slides up, please. I don't know if you can see the slides. Next slide, please. So as you see from the slide in front of you, we've had a decline in the number of cases, and we are seeing a gradual reduction in the numbers of people in hospital, in ICU, and with ventilator use. So we're on the other side of the Delta surge that we've been experiencing since the beginning of July. Next slide, please. When we look at the impact of on our hospitals, we see that 47% of the admissions to our local hospitals are now from Travis County residents. The vaccination levels are listed here. We have unknown status for 168 of the individuals in hospital. So this number of not vaccinated, partially vaccinated, is only representing a little less than half of those who are in our hospital systems at this point. And this remains a situation where almost all of the individuals in hospital are unvaccinated. The picture on the right-hand side of this slide depicts where people reside who have been hospitalized and gives you a bird's eye view of the geographic from a geographic perspective, and you see that we have people from various parts of our county and surrounding counties who have been hospitalized. Next slide, please. If you look at the distribution of hospitalizations based on race, you see that 72% are white and 44% of those reported as white are Hispanic, 10% or 11% are Black, and then we have a large representation of those who are reported as other, which is the category that people are placed in when they do not choose one of the other races that are listed. And 2% of those hospitalized were Asian. 52% of those hospitalized were male, 48% were female. And during this last surge due to the Delta variant of COVID-19, we saw a higher percentage of individuals hospitalized in the 30 to 49 year range than we had in previous surges. The next slide, please. The age group of 50 to 69 continues to be the highest percentage of those individuals hospitalized, but as I mentioned earlier, in this surge, we had a greater percentage of those in the category of the 30 to 49-year-olds hospitalized, then followed by those who were 70 plus. We also had a higher number of pediatric patients admitted during this surge. And in the last reporting period of September 12th through October 10th, we had 72 admissions, 21 were in ICU, and 1 was on a ventilator. As of yesterday, we had 8 pediatric admissions. None of those were vaccinated. 2 were in pediatric ICU or PICU, and 1 was on a ventilator. Next slide, please. We look at our schools. We see a slow decline in the numbers of cases. However, the reporting period of October 4th through 10th may indeed not be accurate in that we had a holiday yesterday, and typically schools send in their reports on Mondays, so that may be artificially low. And when I visit with this group or send a memo next time, I will update that, so that number may actually be a little bit higher. There were a total of 242 cases reported in our schools. 204 were in students, 34 in staff. There are more cases in the classroom setting, and that's then followed by after school and athletic events. We had one case that was discussed in the news where a teacher unfortunately passed, had several contacts, close contacts, and that's resulted in 2 positive cases. There have been several class closures over the months that school's been open, and some sports-related exposures that have been reported as well. Again, masking is what has helped decrease spread, and vaccination is what keeps people from getting sick. And those continue to be our main avenues for protecting ourselves from COVID-19. In our long-term care facilities, we've had just 13 cases in the last 14 days. all of the cases that have occurred were in fully vaccinated individuals, and none have required hospitalization. Again, showing that our vaccines are protecting us from having severe disease and hospitalizations and death. When we look at our breakthrough cases from those individuals who've been vaccinated, we see that there have been several cases, 8,019. However, we've deployed over 1.6 million doses of vaccine in our county. And we also have over 70% of the people who are eligible for vaccinations now fully vaccinated in our county. A great milestone. And of those 8,000 plus individuals who've had breakthrough cases, 89% of those were symptomatic. 82 were hospitalized, so that percentage is very low. The median age of those affected with the vaccine breakthroughs was 72 years. 41 received Pfizer, 25 Moderna, and 16 J&J. There were 43 COVID-associated deaths in this group. This stresses the importance of our continuing to use masking to prevent spread indoors. We've just crossed the threshold of stage 3, but I would urge our community to continue those practices that have kept us safe and helped us get through this last surge. The vaccine breakthroughs represent a very small percentage, as I mentioned, of the cases that we've seen. So again, it's important for those who are unvaccinated to go and get that vaccine. If you look at the next slide, I want to talk a little bit about reinfections. There's still a lot of work to be done to identify how our immune system is responding to COVID-19 and producing natural immunity in those that have had COVID-19. As you can see from this slide, with the appearance of this Delta variant on the scene, there was a spike in the number of reinfections. So the fact that we're able to produce antibodies is important. It is our body's way of fighting off disease. However, neutralizing antibodies may not work as well on subsequent variants, and we still don't know the durability or how long those antibodies that are produced from natural disease last. So although there is some protection conferred, and we don't know how much antibodies needed to keep you from getting sick from COVID-19 after you've had COVID-19. And at this point, we are still saying that the protection only lasts for 90 days. That may change with further research and assessing what our body's immune system is able to do. So I show this slide to say it is still important for those who have had COVID-19 to go and get vaccinated. And it's still important for us to protect ourselves from getting COVID-19 by wearing masks. Busy slide, the contents of which show that the COVID vaccines that we have in the US are highly effective against COVID-19 infections that require hospitalization, ICU admission, emergency department or urgent care clinic visits. And this vaccine effectiveness is extended to populations that have been disproportionately affected by SARS-CoV-2 or COVID-19. So it's important that we continue our efforts to vaccinate our population. On the slide following, that is discussing the deaths that we've seen related to COVID-19 since vaccines were deployed in, if you can go back to the previous slide, please, since they were deployed in January. And we've seen 549 deaths since January. 7.8 of those were in vaccinated individuals. And the takeaway from this slide is that vaccines do protect those who are receiving them from severe disease, hospitalization, and death. And those who died from our case investigators' reports were those who had coexisting medical conditions. The next slide, please. Travis County admissions, again, are being reported here. And again, just showing that we have 47% of admissions from Travis County, and the remainder are from surrounding counties. So it's important that we work to continue to vaccinate our county residents, and also to look at encouraging our communities that surround us and have them vaccinate as well. Next slide. We've had a huge success in vaccinating our population, but we do know that with this variant that we still are battling, that masking works to decrease spread. So as we move, this study is one from Germany that shows that with masking, we can have a great reduction in the number of cases that we've seen. And as we look at our success in working through this last surge, as we had an increase in masking, we saw a decrease in the number of cases that were hospitalized. And also, as we reached that 70% mark of eligible people that were vaccinated, we saw that had another good impact and decreased our case numbers. It's important that we continue those efforts going forward. We still have people who are unvaccinated. We still have the flu to contend with, so it's important that people receive their flu vaccine. And as we move into stage 3, next slide, please. We're going to be asking that masking continue for unvaccinated and partially vaccinated people indoors and outdoors where social distancing is not possible. Masking for the vaccinated will be recommended indoors when traveling, and for those who are high risk when they're dining indoors and not actively eating or drinking. High-risk individuals are also recommended to avoid crowds in indoor venues and avoid unessential travel. There will be one change to the risk-based guidance chart that we're sharing with you today, and that will be that you'll notice that instead of the stage 1 category showing less than 5 cases, it's going to say 0 to 4 cases. So that's a change that you'll notice. And we're going to continue to study the impact of the Delta variant, work with our UT modeling group to assess vaccination, masking, and other factors that impacted us during this latest surge. We know that because there's a possibility of the development of a new variant, that it's important that we look to giving our community actions and behaviors that they can take to protect themselves and their families. The primary ones being vaccination and use of masking appropriately. However, we're going to look together as a group and develop a strategy for communicating and messaging that so that our community can continue on with protecting itself and do so in a way that allows us to participate in the upcoming holidays in a safe manner. And with that, I'll end my report. Thank you.
Thank you, Dr. Walks. Good morning. Adrienne Stirrup, Interim Director of Austin Public Health, and I'm going to give you a brief update on COVID-19 operations. I will truncate my presentation a little bit to leave time for my partners at the county to give their updates, but during the question and answer period, if there's anything that I didn't mention, I will be happy to go over. So just looking at our response activities over the month of September, you can see that we've given over 3,600 vaccines, administered over 10,000 tests. We had over 11,000 new COVID-19 cases reported and processed by our EPI team. Our equity line took over, and nurse line took over 3,000 patient inbound and outbound calls. And those include calls from community calling about the regional infusion center. We've been doing outbound calls, helping folks get scheduled for third doses. And now that boosters are online, we've continued to do that work as well. Over 1,000 families were supported through PPE and food distribution. And we provided over 21 vaccine education activities within community. When we look at the doses that we've given out, you can see here, the majority in our community is now Pfizer. So first doses administered in September were 1,400. We administered 1,500 second doses, the majority of those being Pfizer again, and over 600, just under 700 doses, third doses of Moderna. And I believe right now, third doses, that category does include boosters, and we're working on a way in our system to be able to break those out accordingly. With the tests, you can see that St. John's continues to be the most popular place for people to come and get a COVID test, just under 7,000 administered, 226 mobile tests, and at our Dove Spring site, we saw just under 3,000 community residents. And so our testing options remain the same for this next operational period. We will continue to be at the Dove Springs Rec at St. John's. In-home testing is available if you call 311 or 512-974-2000. We continue to support our partners with facility testing in long-term care shelters and other congregate living spaces. And we are still providing mobile tests. For our residents that need mobile tests, they can call 512-972-5560, and we will come out and give you a COVID test. When we look at our vaccinations by week in Travis County, we can see that we're tapering off again with just under 1,700,000 doses delivered in our community. When we look at our Travis County residents who have not received a second dose, that green pie or teal keeps getting smaller. The last time I was in front of you, we were at about 210,000 people who were unvaccinated, and now that number's at 201,000. And so for the folks that just have one dose, we see that it's at 107,000. And so we're making some really good progress towards getting our folks fully protected. And when we say fully protected, we mean those who have completed either a 2-dose series of Pfizer or Moderna or have had a Janssen shot. Some good changes, not a lot, in our vaccine data by race and ethnicity. You can see week over week, we are seeing incremental increases in our Hispanic and Black populations, but there's still work to be done. And that is the main focus of all our vaccine and community-based street teams, really being in community spaces and places to encourage and provide vaccine opportunities. This map is key to us helping define our operational emphasis for the week. The first dose map is looking pretty good. There's just that one yellow spot here, and we know intuitively it's probably a data issue because that represents a lot of UT students. We do know that the UT is doing a lot of good work with testing. At our last hospital call, I believe they reported a positivity rate that was less than 1% for their students. When we look at our second dose map, unfortunately, there's still some yellow here in 617 and in the 445 and in 53, but not for the lack of effort on the part of APH as well as the county collaborative. And I'm sure they'll talk about their efforts in those areas. And so our vaccine operations, we continue to provide walk-up options. Our static locations are at Southeast Branch Library, Little Walnut Creek, Pflugerville, and at the Delco Activity Center, and at Sims Elementary. We did have to allow the contract with the Central Texas Allied Health Institute to come to its natural end, but to make sure that we still had a presence in that community, we arranged to have space at Sims. And so we will be providing Moderna and Pfizer at those locations. In addition to that, our mobile operations will be at 7 different middle and high schools. We'll be at the Austin Transition Center. We'll have a presence at the Fest in Pflugerville, not even going to try to say that first word, and at the Health Worker Career Fair.
That would be Dodge and Fest.
I appreciate that, sir. Thank you. All right. And so booster and pediatric vaccines, a lot of buzz in the news this week. The FDA committee is expected to meet on the 14th and the 15th to discuss booster doses of Moderna as well as J&J. And also to give more information on the ability to mix and match your booster doses from your original series. Of particular interest later this month, the FDA will meet to look at Pfizer's data for vaccines for 5 to 11-year-olds. And so planning ahead for PD vaccines when they become available, the key points that we're looking at, making sure that we have an adequate supply in anticipation of the increased demand for Pfizer. We were mostly a Moderna community, but we know that once these come online, because they're the only option for kiddos, we want to make sure that we have enough vaccine on hand. Making sure that we're active or proactively addressing vaccine hesitancy with kids' parents or their primary caregivers. We're encouraging community-driven vaccine demand, so really working with our partners, all the things that we've talked about, those boots on the ground efforts to make sure that we're getting information out to folks in vehicles and in spaces where they feel comfortable and trusting. We're making sure that we have that very special workforce identified. It takes a special person, I'm told, to give a PD shot, and so we've been steadily recruiting those nurses and offering training and support. And we know, based on the information, that our eligible population will increase by 114,519. And so really the work that Cassandra DeLeon, who is our Chief Administrative Officer over Disease Prevention and Health Promotion, she leads all the vaccine efforts, the work that she's doing with Mr. Brotherton at the county to make sure that we have a concerted strategy to address PD vaccines is quite encouraging, and hats off to both of them for their leadership in those efforts. As part of the resolution 110 that was issued a few months back, at our last meeting, I gave you an update on the initial lessons learned from the vaccine rollout. On the 25th of October and on the 30th of October, we're going to get more community input through a virtual town hall. We really want the community's voice to be reflected in the updated booster as well as the PD strategy. And so our APH PIO as well as the city's PIO team is really working to make sure this is an inclusive event. It will be centered on equity, making sure that we have languages available for folks to participate and feel comfortable. And so that means simultaneous interpretation as well as breakout rooms by someone's preferred language so that we can really have that two-way dialogue. This is a place where we don't want to report out. We want to do as much listening as possible. And all of that information that we received from these engagements will be culled into the final report that we will present to Mayor and Council early November. In addition to the virtual town halls, we will also have a survey that will be pushed out widely through our social media networks to make sure that we offer every opportunity for people to share what they loved about getting the vaccine, what they hated, what their hesitancies are, and what they feel we should be doing more of. Part of this effort to be more in touch with the community and really having that intentional focus is beefing up our community health worker staff. So we already had one health fair. We're having great response on our social media outlets. We'll have another health fair specifically for community health workers on the 16th. And we're hoping that we are able to recruit a strong pool of applicants that are not only bilingual, but have roots in the communities that we are focusing on to help us improve our reach. And very briefly, just talking about some outreach events. We are at St. James Missionary Baptist Church. We serve 445 families with PPE. And then on the 9th, we were at Ditmar Park. Again, you know, having that combination of helping you protect yourself with PPE and information about vaccines, but making sure you get your basic needs met as well. Places that will be this coming week will be the Northeast Early College Academy. We'll be at the Manor Night Out, the Mexican Consulate, the Dutchen Fest, and we will also be at the Woodview Mobile Home. And that is it for the operational updates. I thank you for your time this morning.
Thank you.
Pretty good, except for Deutschen.
Yeah, Deutschen.
We'll
I
work
tried
on that
it.
next time. We'll get it right.
Well,
All right.
well, I learned something today. Chuck or Constable, are y'all there?
Judge Chuck Brotherton, Travis County Executive for Emergency Services. Good morning, Judge. Good morning, Mayor, Court, and Council. Just to update y'all quickly on the activities of our county collaborative. I'm hopeful you can share my screen, or you can see my screen. I want to show you what we have done in the last week. We did a total from last Monday through this past Sunday. We did 841 doses at our expo center, as well as at a variety of pop-up or strike team locations throughout the Eastern Crescent. 841 is an uptick from the prior 2 weeks, where the numbers seem to be dropping. But then I would just note that our combined efforts, Austin Public Health and the Travis County Collaborative, in the month of September, I think it's important for y'all to understand that together we did roughly 7,500 doses in the community, which I think is very encouraging, and the work that we continue doing is very important. Total Travis County residents served from or by the collaborative with Travis County ESD 11 as our vaccinator of record, 32,601 to date. That is starting from about April to present. Before that, we were working with Community Care as our vaccinator of record, and shots delivered by Community Care were about 73,000. So together, all told, the Travis County Collaborative is about 105,000 doses so far. lot going on this particular sheet. Just quickly looking at the other number here, 3,675 to date. Those others are found in the upper quadrant of this slide. You can see by the various colors around the country, the little dots around the country and around Texas. These are locations that the patients reporting outside of Travis County reported to be from. So you can just see this illustrates just the number of people from around the country who are visiting Austin and Travis County and taking advantage of an opportunity to get a shot. Though, of course, there may be people who have moved here and just haven't yet changed their address. Looking down in this portion of the slide, beg your pardon there, you can see vaccine over the past 30 days. Yellow is first dose, red second dose, and then green third doses and boosters, so that you can see from September through October the 10th, just the numbers of first and second and third doses. And then with a little bit more time from the end of March of this year through this past October the 10th, this graphic just illustrates the flow and the demand of folks seeking shots. And then in the upper right, whoops, pardon me, sir, the blue boxes here indicate just by size the zip codes and the vaccine uptake in each of those zip codes. Then on this this page, you can see the number on the left-hand side, the number of strike team events held in each of our crucial zip codes. So 78653, we've had 9 strike team events from inception to date. 78724 right here in the middle, that's where the county expo center is located, so that number is going to be quite high. 78744, 70 strike team events to date. Over on the right-hand side, this map shows the zip code and the total number of doses for the preceding week. Again, 78724 being the highest. Again, that's where our expo center is located. Would also like just to follow up on what you heard from Director Stirrup regarding the Central Texas Allied Health Institute. Dr. Hockaday's contract with City of Austin did come to its natural conclusion at the end of September. Travis County is picking up a contract with Dr. Hockaday and the Central Texas Allied Health Institute. And Judge, that is on today's agenda for a contract to transition the CTAHI efforts from the brick and mortar Anna Lark Center to strike team and pop-up locations that they have identified to be working on from October 1st, which is going to be the effective date of our contract through February and likely beyond. But we are bringing it's a 6-month contract with CTAHI with 2 options to renew for a total of 12 months, again, to help us to supplement the efforts in getting into some of our harder to reach segments of the community. I'm looking forward to working with Dr. Hockaday. And at this time, I will turn it over to, excuse me, to Constable George Morales with Constable Precinct 4 for his updates.
Good morning, Commissioners, Council members, Judge, and Mayor. We continue to focus on outreach and education, doing the work to ensure that our strike teams are successful. Our mobile vaccine teams gave a combined 841 shots this past 7 days. A total for the month of October was 1,454, with 109 of those given at ACL. We handed out a total of 3,100 flyers with an additional 600 phone calls to targeted areas. We still continue to target those specific areas in the highly affected zip codes in Austin, Travis County. We will continue working with AISD, targeting our Title I schools. We have Perez Elementary and Guerrero Thompson Elementary scheduled, along with 30 other additional clinics that we have for this week alone. On top of that, this Sunday, we will be participating with Sendero Healthcare, Walgreens, Constable 4, and hosted by the Del Valley Community Coalition we will be doing a drive-in movie this Sunday at the high school where we will be offering flu vaccines along with COVID-19 vaccines. Again, some special interest this week, Plumbers Pipe Fitters Union, Manor ISD Elementary, Manor ISD bus drivers, St. Louis House, Centacor Foundation, of course, our static locations of Poco Loco and JD's supermarkets. Turn it back over to Chuck.
And as I do like to share with the court and council, just to show y'all where our various vaccine information locations are found on the county's website, on the city's website, as well as on vaccines.gov. At the county landing page, very easy for folks to find out where we are holding vaccination pop-up events on any given day. So click on traviscountytx.gov, go right to our vaccination page, and you can see our calendar. Tuesday, October 12th, a variety of locations. These are Austin Public Health, Community Care, Williamson County. We've got several sites that are regular locations for APH. Our various pop-up locations, as the constable mentioned, we are at the 4 JD markets this evening, starting at about 5. You pick up any particular event, click on it, you can see all of the information. On the city's landing page, also very easy to get to COVID-19 information and then find locations for free COVID-19 vaccination here. And then if folks are looking for a commercial pharmacy, then vaccines.gov, which is published both in English and Spanish. It's very straightforward. Click on find a location, enter in a zip code, and I will enter in 78612 within 5 miles, and then find a commercial provider, private pharmacy. I think what you see here, folks, is that this really underscores the need for us to continue doing what we're doing because in some of our Eastern Crescent zip codes, there simply aren't commercial pharmacies available. And so we are providing a very important service in those parts of the county. And I will stop sharing my screen there. Judge, turn it back over to you and the mayor for questions.
Thanks, Chuck. We'll go through the regular order of questions, and we'll start with Commissioner Gomez.
I don't have any questions, Judge. Just a comment. I'm impressed with the enthusiasm with which the collaborative team continues to go out and contact people, getting them to get vaccinated. And so for that, I'm very, very thankful. And so keep it up. Thank you.
Thank you. Commissioner Shea?
Thanks, Judge. And as usual, thanks to all of our incredibly hardworking staff. I don't know when Constable Morales gets any sleep. But I especially want to call out, they set up a pop-up vaccination setup at the Wells Branch National Night Out, which I don't know how many people there were, hundreds at least. And they've just been really strategic and smart about going to where the population is that still has some of the lowest vaccination rates in the community, and really, really trying to help educate folks, get them past their hesitancy or correct the wrong information that they've heard about the vaccine. So I just really want to acknowledge Councilman Morales and his whole team, and Chief Bailey, everybody who's been working so hard to really reach the population that continues to have the lowest rate of vaccination, some of the highest rates of spread of the COVID virus. So hats off to all of you, but I just really wanted to acknowledge the work that our strike team at the county has done in trying to find the people and going to where they are. So thank you all.
Thanks, Commissioner. Commissioner Trevelyan?
I want to echo what my colleagues have said. I really appreciate the time that has been taken and the care that has been given. Certainly when we think about the effort that has been put together, not only across the county but particularly with our pop-ups, I think that significant work has been done. We still see that our numbers need to grow. And what I would like to do with the constable is challenge him for the next several Friday night football nights. Pflugerville is playing Weiss at the field on Friday, so I might have to challenge you to be at that game. And if there's a precinct 4 versus a precinct 1 game, I want to challenge you on that one too. Let's see how many community events we can get out to between now and the end of the football season. But I do plan to challenge you during basketball season as well. So I just want to point that out. So Friday night at the field. So I'll be looking for you.
Awesome. Good idea.
Thank you, Commissioner. Just to let you know, I do have another team member on this team that I would accept that challenge, but I'm going to clear it with him first. And secondly, when it comes to basketball, we know Aikens and Del Valle is rocking the show. So you might get an acceptance on that challenge also.
I might have a hamburger on one of those. I don't know. We can talk about it.
Commissioner Howard?
Yeah, I think I won in on this Friday night fun. Thank you, guys. Thanks for working so hard. I wanted to ask Adrian about the slides on the community health workers recruitment effort and the Speak Up Austin. If you could just talk for a minute about the collaboration like between your department and your communications team at the city. Are you having to drive that work, or is the communications team driving some of that work? How are y'all doing that?
We've been in this so long. I mean, it's kind of like when you're at a sleepover and you have somebody else's socks on and you took somebody else's bag home. The lines have definitely been crossed, but APH does lead the majority of the efforts, but with super support from the city CPIO team.
Okay. All right. Thank you. I also was curious with Chuck or somebody, like, where are we with requesting any reimbursement from FEMA or the feds on all the money that we continue to spend? It's probably not FEMA, but is there any news on the reimbursement process?
Commissioner Howard, we continue working very closely with our budget office and our auditor's office to make sure that we are tracking all of our expenses. We know from long experience that the FEMA reimbursement process takes time. And so the documentation is the key, and we continue doing that. We are identifying just about everything we are doing at this point under the FEMA Public Assistance Grant guidance should be reimbursable, and I just emphasize should because sometimes the rules change. But again, the most important thing for us to be doing at this point is tracking our expenditures, and that is what we're being very, very vigilant about doing that.
Is it open to submit your paperwork for reimbursement, or is the country not there yet?
No, I believe that some of these things have been submitted. I hesitate to get out too far outside my lane. I'd need to check in with our auditor's office and Eric Carter and his team at our emergency management office just to make sure I understand exactly what has been submitted so far.
Okay, thank you.
Thank you. This question, I think, is for Director Stirrup or Dr. Walks. So first, want to thank you for all the efforts that you're undertaking to get input and raise awareness of pediatric vaccines. That's obviously going to come at us, sounds like very soon, which is great. One wrinkle on it, so I called my pediatrician's office, I have 2 kids, 5 and 6, to see if I could get on a list or wait list or schedule something if that is to come available. And they let me know that they don't do flu or COVID vaccines at all. They haven't been doing them for 12 to 17-year-olds. Another, I think, friend of mine, her office also doesn't do them. Her pediatrician doesn't. And I'm guessing, as we all know, the joys of Pfizer are that it's really hard, especially compared to Moderna, to prepare. And it takes, we had a whole team of students from Del Valle ISD mixing it at Circuit of the Americas, and we're sort of supplying it to different locations around the county at one point. but that's not something to be underestimated, just how difficult it is, especially I would imagine for these really small pediatricians' offices. I think my pediatrician has 5 doctors. The other one, I think, that I heard from has 3. And so I can't imagine just the logistics of how that's working. But I was wondering if, I know that we are, I guess the hope would be that pediatricians' offices would help vaccinate children when this becomes available. But if that's not the case, could we try to get a handle on that and see if there's some way that working with, I don't know, our hospitals or with our great vaccine team from Ascension or George, that we could maybe offer to prepare vaccines and distribute them out to pediatricians' offices? I obviously don't have the answer to that, but just wanted to see if y'all could focus on that maybe over the next week to see if if it really is the case that a lot of pediatricians' offices aren't offering it, then I feel like we really need to come up with another plan or help them offer it in some way.
Judge?
Yes, sir.
It seems like, since public schools are mandatory, and since a lot of these kids will be in school, could we not coordinate with our various school districts and work through our school nurses program? Maybe that's the quickest, easiest, where we wouldn't have to mobilize. They're there.
Absolutely, and we are doing that. I've met with Constable Morales about trying to do that first week in Del Valle. I just remember, I think someone from APH saying we were also relying on pediatricians to do it. I agree. I think that's probably the best way, but if we're in a scenario where kids are going to have to get vaccinated yearly for COVID or coronavirus or something, it seems like figuring out now how to make that a part of just when kids come in for their well exam to the pediatrician to do that, or when they go back to school. But yeah, I think your point is a really good one, that working with the ISDs is something I think that some folks are doing.
And I will volunteer to reach out to the African American physicians community to see whether we can organize some. I'll volunteer to do that.
That's awesome, because I do think this is a real opportunity to try to, like you said, reach out to African American populations, kids first, Latinx in Del Valle and Manor and Pflugerville, and I really do hope that we can focus on that. But Director Sturp, any thoughts on, or Dr. Wilkes, on the pediatrician angle?
So I'll say 2 things and then I'll allow Dr. Walks to comment. I appreciate you doing some of that legwork. I'd be curious to see what the response will be from retail pharmacy, because they are the largest provider to date of vaccine in our community. And so I'd want to see like the Walgreens and the other partners that we typically partner with, what their stance is on that. There's some logistical nuances to us providing vaccine to a pediatrician's office because they're a separate provider, and it can be done. I think where our space would be is education and support, but definitely open to having the conversation. So for me, it would be to get a handle on what the retail pharmacy's expectations are in this space, and then 2, to have those conversations within the pediatric networks, and perhaps Dr. Walks can help with this to see what supports, if any, they would need in order to be a provider. Dr. Walks, did you want to add anything to that?
No, I think you've covered it, Director Sturp. The nuance with the Pfizer vaccine is, of course, as everyone knows, the storage and handling of that particular product. And I think that in our vaccine coalition discussions, that those issues can be discussed and we can flesh out how we can best assist.
Great, thank you very much. Mayor, I will pass it on over to you.
Thank you, colleagues. Let's begin with Mayor Pro Tem, District 1.
Thank you, Mayor. I appreciate it. This was another winner in a series of comprehensive meetings where most of my questions have already been answered. The last question I had was about training for providers of immunizations for small humans. I know that can be a challenge. And so I appreciate that y'all are already thinking about providing specifically training The other question I was going to ask was whether or not Central Texas Allied Health Institute was going to be considered in that pool about potential providers. But then I hear that you guys are, the county's taking up the item today for the arrangement between the county and Central Texas Allied Health Institute. In which case, the one question I do have is, what does our provider pool look like? Is it sufficient, or are we still deficient on providers of immunizations? I'm not sure who the question is for. Maybe Director Stirrup.
I mean, I'll take a stab at it. Breaking all the PIO training, when they tell me you don't know the answer to the question, say I'll get back to you. But what I do think that we're going to see the same problems that we're seeing with the adult vaccine in the places where there are not a lot of infrastructure. And so from a public health perspective, it's important for us to be able to fulfill our role and be that safety net indigent care provider of vaccines. That being said, I understand that we also have a duty to the larger community, and we'll work with our partners. Community care is a huge player in this space. So to reach out and have conversations with them about what their plans and capacity will be with respect to providing PD vaccines will be important. Thankfully, we already have those networks in place through the Vaccine Coalition. Dr. Walks, in her wisdom, invited the health authorities from our surrounding counties. And so we can really have that, Travis County focus, but understanding that what happens in our neighboring counties impacts us as well, making sure that we're providing information and resources to them. And so I believe that we have enough resources in place to take on a significant role for the communities we usually serve. We have to have more conversations to see what we can do beyond that.
I appreciate that. Thank you. It sounds to me as though there's an opportunity here to preemptively do some capacity building in that space. And so I look forward to continued conversations.
One thing I will add is that we're in the process of negotiating or putting out a solicitation for a turnkey vaccine provider, which the organization that you mentioned will be encouraged to apply. And so key to that will be the ability to give pediatric vaccines and the experience working in community-based settings and servicing diverse communities. So when we're looking at that solicitation, we're making sure that we're attracting a vendor that can fill those needs.
Thank you. So I first wanted to say thank you to the Travis County Collaborative, the strike team, for all your hard work. I know that y'all were giving out vaccines even at ACL, and people were getting vaccinated during the music festival, which is great to hear. So appreciate your work, and I appreciate Austin Public Health, our public health department, and the team there for your incredible outreach efforts. It was really nice to hear about the upcoming community town halls that are being planned for later this month, and the intentionality behind being inclusive and creating that space for folks to provide feedback on how we deliver vaccines here in Austin. So I appreciate y'all leading the charge and holding those two community engagement opportunities later this month. And also thrilled to hear about us moving forward with the hiring career fair for community health workers, and to see that investment that the city has made, and that we've also received federal funding for move forward, and see efforts to increase and ensure that we have a robust community health workforce at the ready is exciting. So I've already shared it out, let the public know, like, hey, you want to join our team and become a community health worker, go to Montopolis Rec Center and find out more information. I have one more comment I wanted to make is around the pediatric vaccines. Some of the feedback that I'm hearing from my community is the need for some type of waiver in school settings so that the kids can get vaccinated without the parent physically present. I know that was something that's come up, like having a process in place where parents can sign a waiver to allow their child to get vaccinated while in school. was something that has been talked about. So just wanted to bubble that up. So that's part of the conversations that we're having with the school districts, is understanding that that is an option that I've heard some parents want to see happen, just to make it easier for folks, especially working families who might not be able to schedule multiple kids with their pediatric doctor and or might not have access to that pharmacy. And lastly, my question is around incentives. We know that Governor Abbott has added to the call or has issued an executive order regarding prohibiting any entity from having a vaccine mandate, thereby making it harder for folks, for us to help ensure that we have a vaccinated community. And so my question is, knowing that that is happening or will happen or has happened, what can we do regarding incentives? So Director Stroop, if you can speak to, I know we had an incentive pilot program that we held up for a little bit, but what is our plans around vaccine incentives, and or what are you hearing from the business community about, employers and what they're doing to ensure that employees are getting the vaccine? I'd be curious to hear about this effort, knowing that we now have state regulation prohibiting those type of requirements.
And so we have initiated a purchase of gift cards to continue that pilot. And we're just waiting for that transaction to be complete. Once our corporate purchasing finish its contracting process and we acquire the gift cards, I think I heard December or January this morning when they were giving me updates. We will roll that out. Our focus will be on making sure that communities get that initial protection. So it will be focused on first and second doses strategically in the areas that we still see on our map that are not at that 70% mark. And so the rollout will be quite different from the pilot. We learned a lot about that. And our hope is to work with our partners in the collaborative, because they're doing that really good boots on the ground work as well, to see where those spaces are that we need to be once we actually have the gift cards in hand. As far as the business community, I think the city of Austin has set a really good example with the incentives that they've provided their employees. We can do some additional research and share what we're doing. That would be a task for our corporate CPIO team. And some of the things that we are doing as a city, that if you are vaccinated and you unfortunately contract COVID, then you get special COVID leave to help you recover. It doesn't have to come out of your sick time. Other things that we've heard is that there is an adjustment to insurance premiums, much like the tobacco premiums for folks who are not vaccinated. And so those are some of the creative ideas, not only that we've implemented as a city with the leave, but I've heard in community. But we can get with CPIO to figure out how we can have a communication strategy or push to engage our partners in the business community with those conversations.
Thank you, Director. That's helpful information, and I appreciate your work on that. Glad to hear that the APH vaccine incentive program will continue. Would like to encourage us to have that sooner rather than December, January, knowing just how critical and important it is to have that first layer of protection. But thrilled to hear that, progress moving forward. Thank you.
And Councilmember Fuentes, if I may, just to update y'all on what the county is doing. And county, at the court's voting session later this morning, we'll be hearing a little bit more about the program that we're exploring, which is something that emulates what Harris County has been doing, where we may partner with community organizations to support their outreach efforts to bring in folks for vaccinations. So I don't have the details in front of me right now, but that is something that the Commissioner's Court will be hearing more about later today.
That's great. Thank you. I'm excited to hear more about that. And I love that it's in collaboration and partnership with community organizations. And so thank you, Travis County, for all the work that you're doing. It seems like y'all have a pretty packed agenda today.
Thank you, Councilmember Renteria. And thank you for being with me today on the dais. Kind of lonely, just you and I here. Go ahead.
Thank you, Mayor. I just want to find out if, with the ACL that we just had, how many positive infections that we had from week 1?
Good morning, Councilmember. We have had reports of a handful of infections, and we're still doing some ongoing case investigations for the cases that we've been presented with in the last week, and we'll be doing that going forward for the next 14-day period. As you know, that's when we're going to be looking to see what the impact has been, but so far it's been just a handful.
Thank you. When I went there last week, I did notice a lot of people that they all had their masks on when they came in, but as soon as they got out there on the other side, they took it off. And I was really concerned, but it seemed like what ACL did with mandating that they have to show a vaccination card or a document saying that they tested negative in the last 3 days. It's it's a reminder to the public of what we can do. That we can have safe activities if you're vaccinated. They could come out and have a good time, and not have to worry about getting the COVID. So I really want to thank ACL for what they did. And I was very worried at first, but when I heard the report of of how many infections were linked or positive results that were linked to ACL, I was really relieved to see that. And I just want to remind the public, this is what we can do if everybody gets vaccinated. And so please get your COVID vaccine and let's enjoy the holidays that are coming. Thank you.
Thank you, Councilmember Kassar.
Thank you, Mayor. And my 2 questions I had written down were the exact same 2 that Councilmember Fuentes asked, and I would.
Can you all hear Greg? Can you speak up, Greg?
Looks like we lost him, Mayor.
I think so. So let's go ahead and we'll come back to him when, here he is.
Here, Mayor.
You need to speak up.
Okay, sorry. My 2 questions were Councilmember Fuentes' exact 2, because in my community I'm hearing the same question about permission slip at school and about incentives. And I would show you my notes proving those were the same 2, but I don't think you could read them. But Director Stirrup, I don't know if you actually got to the question of permission slips when responding to her question. So I think it would be really useful for us to hear whether or not y'all are already coordinating with the superintendents, or whether it would be useful for us to reach out to principals in schools, because there have been a lot of families. I've had several meetings with promotoras and other folks trying to spread the word, who have said that this is a really persistent issue for people, is finding the time to get off of work and coordinate with their kid and be there at the same time as a pop-up. And I think when we talk about just these thousands of kids who could soon become eligible, if everybody could get sent home in their backpack a permission slip they could just sign, which we're so used to, signing a thing, coming home and your son or daughter's backpack, I think it could be really efficient. So I think it could be helpful for you to lay out to us if there's anything the commissioners or council could do to help that be universal.
I believe that the will is already there. Dr. Walks and I meet with the superintendents for the county, and that has been brought up, and so they're in full support. The operations teams work with individual campuses. We have relationships with the school nurses there, and so our program staff have said that it is doable, and we're coordinating with the specific campuses and the school nurses there to figure out the process that would work for that particular location. And so at this time, I don't believe anything needs to be done. Everyone understands the urgency and the need to make it as convenient for parents as possible, and the work is progressing.
I appreciate that, Director. And just given, that Commissioner Trevelyan mentioned it, and Councilmember Fuentes stole the question from me, I think we're hearing similar things, right? In our communities may be different, but they're linked in so many ways. And so all three of us raising that, I think, is proof to me that if we get this done, it will be a big step. So thank you.
Thank you. Councilmember Kitchen.
Thank you. I appreciate the information. I don't have any questions at this time. I would say that I think it's important for the community, again, to see that we've been able to progress in the right direction. And just want to urge, as my colleagues have, that people get vaccinated.
Thank you. Councilmember Kelly.
Thank you. I'm just curious, with us now moved into stage 3 guidelines, what that effect might have on city employees that are masking in city buildings, if there's any effect whatsoever.
So, go ahead, Director.
Well, I was going to say, as long as the health authority's recommendations are for masking to indoors are in effect, our APH would support the city manager in keeping that policy in force. And so I'll allow you to comment, Dr. Walks.
I would just recommend that we proceed with the same safety measures that we know have worked thus far. We're going to be mitigating for COVID and for other respiratory illnesses going forward, as this is the season for that. And we're already seeing some increases in the numbers of flu cases. So encouraging vaccination for both COVID and flu is going to be important. And then taking that extra layer of protection of masking, particularly in situations where there may be high-risk individuals involved in the group settings in workplaces. I think all of those things make sense going forward.
Thank you for that. I know that my office has been getting lots of questions from city employees, and so that clarification is very helpful.
Thank you, ma'am.
Thank you. Councilmember Poole.
Thanks. I just wanted to remark again on the really great decline that we're seeing in our numbers. That spike is really abating, and that's terrific. And it's because people are really pressing forward on getting their second vaccination. Our numbers there look really good, and we are persisting in wearing masks where indicated. I can see why our Dr. Walks, you would want to hold off on making statements about not masking inside for city employees, because we really do need to kind of push that declining line even further, and it's for muscle memory better simply to continue to wear the masks rather than to be ping-ponging back and forth. So thanks for your steady hand on the tiller, you and Director Stirrup. We really appreciate you, and also the folks who are on your teams behind you, and also at the county. Thanks.
Thank you.
Thank you. Councilmember Ellis.
Thank you, Mayor. Yes, I certainly appreciate all the hard work that's going into making sure people have vaccinations. My question is about a timeline. I know you said that later this month, on the 26th, the FDA will be discussing the Pfizer shot for kids aged 5 to 11. do you have any idea of how long they might deliberate, or if they were to approve the shot for the younger kids, how long until the rollout would happen?
Typically, takes at least 2 weeks or so, and that's barring any requests for further information or hiccups along the way. We're waiting with bated breath. Hopefully, it'll be our Christmas present at the very least. But this is one of those wait and see things with regards to making sure that our children 5 to 11 are safely vaccinated. So.
Thank you. So it sounds like there might be a chance that some kids could get shots before Thanksgiving and maybe a second shot by Christmas, but people should still just wait and not assume that that's going to happen quite yet.
Yes, ma'am.
Thank you.
Thank you. Councilmember Tovo.
Thank you. Thanks to all on the call for your tremendously hard and continued work. It's really encouraging and just awe-inspiring, because I know you've been working so very hard and so concertedly for such a long period of time. So thanks to you and all of your staff. Just a couple quick things. The first is that I love the idea of having the parent signatures. I know AISD has done that in the past for flu vaccines, not consistently and not every year, but I know several years ago we had an option as parents to sign that waiver and have our kids get vaccinated for the flu in the schools. So I think that's a really dynamite idea. Thank you for the update. I know the Council's Public Health Committee had asked for an update on Central Texas Allied Health Institute's contract and continued work. And so I appreciate the way you wove that into today's presentation, both explaining that the city's contract will end, but as I understood it, they will be encouraged to apply for some of the upcoming contracts, and the county is considering a contract with them today. So that's really helpful. I think they do very, very valuable work in the community, and look forward to continuing to see their community-based work continue in this effort. I think we really need them. And just lastly, as you consider football games, which are, as a new high school parent, I am overwhelmed at the number of people who show up at football games from across the community. It's a great opportunity. So thanks, Commissioner Trevelyan and others for mentioning that. But I also wanted to mention marching band contests, which seem to be going on in multiple places every weekend, and sometimes, including this week, twice a week. And those also attract hundreds of people, and they're, not just the students performing, but their families. And so I would really encourage our public health folks and those of you who are getting out with those mobile vaccine clinics to think about the marching band clinics as well. Marching band competitions. Thanks again for all your work.
The band members show up at the football game too.
They do, but you've got a captive audience on Saturdays with all the siblings waiting for hours to hear their families. But yeah, you're right. Football games would certainly capture those folks too.
Great, thank you. Councilmember Alter?
Good morning. I'll join my colleagues in thanking all of the folks who are helping to keep us healthy and safe. I wanted to just make a comment about the earlier remark about you need a special person to do the pediatric shots. I think that's absolutely true. They are doing flu shots at the high schools right now where you do consent. I would be very unlikely as a parent to let my child get a shot without me there if they were in elementary school or younger, especially if you have a child who does not like shots. So I just would encourage you to make sure that there are times maybe after school or something when parents can be there with their child. I think we're not going to get that far for the younger ages that will be newly eligible by doing the signatures alone. There may be some parents for whom that's fine, but that would not have worked with my children. And I just want to encourage you to think about both of those, especially if we're talking about that that younger age, and I'm glad to hear that you're recognizing the difference in how you give shots to those younger folks. So thank you for thinking ahead on that.
Thank you. I want to ask a couple questions here relative to moving from stage 4 to stage 3. Exciting to see that we've done that, make that move. I think it's something the community can look at as a recognition of the effort that the communities put forward to get vaccinated. The numbers continue to go up, although there are still over 200,000 people not yet vaccinated that are eligible to be vaccinated, but also people that are wearing masks in situations where they're in close proximity with other people, especially for an extended period of time. There's kind of a reward associated with that, and that's seeing the number of cases and hospitalizations go down. So we've moved to a daily average count now of 19, which is significantly below the 30 number that we start taking a look at whether or not to move to stage 3. And it's actually fairly close to the 15 number that would move us from stage 3 to stage 2. But even though we've made those movements, you're still urging people to be cautious and to still maintain the precautions as best we can in order to preserve this. And I want to talk about this for a second because I know that the public's going to see us going from stage 4 to stage 3 as a sign that we can kind of let up. So my first question is, Dr. Walks, have you seen any kind of modeling from the University of Texas that shows what happens if we still maintain the precautions as opposed to we really relax on those precautions? Have you seen any modeling from the University of Texas with respect to that?
Yes, sir. And with continuing to toe the line and take those precautions, we would have fewer cases and avert having another spike in cases. The Delta variant still 99% present in our community, and with the still unvaccinated individuals present in our community, it's important that we do what we can to protect ourselves and others from having another spike in cases from COVID. And as I mentioned, respiratory illnesses are going to be the going concern in this period of time in the fall and winter months. And with holiday gatherings, indoor gatherings, the spread of respiratory illness is going to be something that we're all going to be contending with. So with continued use of masking indoors in situations where you're with unvaccinated individuals or individuals who are symptomatic from respiratory illness, you'll be best served and protected by wearing a mask or avoiding those situations, particularly if you're someone that's at high risk. If we go down into lower stages and we don't read the room, so to speak, in those situations that we're going to find ourselves in the holiday season, we could have another spike in cases because of the numbers of unvaccinated individuals that we have with regards to COVID.
So I've had the opportunity to see the modeling from the University of Texas that I was asking about that you just confirmed. I want to point that out to the media as well. So if someone wanted to get access to that, 2 different models that show our numbers coming down and what happens if we're continuing to be cautious and what happens if we're not. And the modeling from the University of Texas, which has been uncannily accurate for us in guidance, shows us what could happen just from COVID coming in this winter. You also mentioned that there are potential complicating kind of factors, and one of the you mentioned was the flu. There was a chart that we saw every day, almost for a year, I think. We're not seeing it now, that compared flu in prior years to flu as we were going through this period of time a year ago. I sent a copy of that link, I think, over to the county to see if that was something that they might be able to pull up. There it is. This is a chart that you gave to the Commissioner's Court and the public and to the council that showed the percent of flu for the 3 years plus blue, which was last year. And this chart, the blue line obviously continued past February. I just pulled this one. But you can see what the prevalence of flu was in the 17-18 season, but also the 18-19, also 19-20. Last year, in the 2021, we said to the public, please help us with flu so that we're not filling up our ICUs, which you can see we did in those prior years. And we were able to keep that blue line low, but of course we had mask mandates then, and we were doing all kinds of things like that. That blue line pretty much extended, pretty much below 2% the whole rest of the way, didn't it?
So I can show you the most recent version of that if you'd like to see it.
That'd be great, yeah, if you have that.
Sure.
Because that was my question. Can you show us, go back to showing us in the community that chart so we can watch the flu situation?
Can you see my screen?
Yes.
So the red line is the 2020-2021 flu line. And you'll see, as I'd mentioned a few minutes ago, we're starting to see a slight increase in the number of cases. And so we'll be tracking that going forward.
Okay.
And that's why we've been urging, not only here in our county, but across the nation, for our patients and community members to get vaccinated. Vaccinations as well.
Would you please add a fifth color to that chart and have the 21-22 season beginning with the 1st of October, I guess, is when the chart, so that we can see what's happening?
This is prepared by the Department of State Health Services, so they'll add.
They'll add the 21-22 chart back to the left, and I guess a different color, starting in October. Could you start showing us that chart as part of the report so we can continue to watch that?
Sure.
And the reason I ask those questions is sometimes two concerns. First is we go below 30 and the public doesn't understand why when we cross 30 we don't immediately go into stage 3. And if we were to cross 15 here soon, you might not automatically go into stage 2. And even as we go down in stages, you're continuing to ask the public to remain cautious. And that's because there are other things that you take into account in setting the stages other than just hospital admissions. And I want to kind of give kind of like a peek into that room, that insight, so that the public can understand what's going on in your analysis of the data and the like. The other factors that you look at, other than hospital admissions, also includes things like the positivity percentage in the community. Is that right?
That's correct, sir.
Okay, so you had said today it was like 5.9, which is certainly better than the 12 or 13 or close to 15 that we've seen in the past, and the double digits we just saw like a month or so ago. But 5.9 is not where we want to be. My recollection was when we were doing this last year, we were trying to get it down to less than 2% positivity in the community or something like that. Am I remembering that right?
Well, we'd like it to be 0, but yes.
Right.
Yes.
So there are going to be gradations. If 12 or 15 would be red, just looking at positivity, 5 to 10 might be, yellow or orange, I don't know what the colors would be. You need to do that. But that's an indicator that we look at that tells us at 5.9 we still need to be cautious, because it's like kindling. If that could easily at 5.9 get out of hand. In addition to positivity, you also take a look at the flu level, the flu cases as we come into the season. How many people are having flu? How many hospitalizations we have for flu, or what the positivity rate is for flu, like on the chart that we just saw. So even if the COVID numbers are going down, that would indicate to us lower COVID. If the flu numbers are going out, that makes us more risky and more susceptible. If we do have, as we've been seeing every 2 or 3 months, a spike, it's going to put us in a really bad place.
Mm-hmm.
So you also look at flu numbers. Another thing that you mentioned, I think, that the public needs to remember is you take a look at the total number of our population that is still unvaccinated. So we're over 200,000 people. If that's worthy of, I don't know, a yellow or an orange, if we got to below 150,000, then that risk level could go down. If we got below 75,000, our risk level would go down. But so long as we're having that high a number, that's also a reason for us to continue to be cautious, even though the hospital admission number stage is going from 5 to 4 to 3, and at some point would be going to 2.
And also masking, and I'll show this last thing before for everybody to look at. And this is from the Carnegie Mellon assessment of how we're doing with regards to masking. And you can see that in the latter part of, during June, our masking rates were lower. And then as the pandemic surge from Delta started and we implemented the stage changes, that our masking rates went up. And if you look back at the slide that I showed you earlier with regards to our case numbers, those started to decline as well. So.
Okay, so again, I think that's a really good graph for us and the community to see that our behaviors have in fact changed. That change is happening at the same time as we're seeing an impact of these kinds of behaviors and the like, and also helps us understand why it is that even with the stages going down, you're still urging people, let's not go back to where we were in June or July, because we saw what happened when we relaxed that much in June or July. I don't know, Dr. Walks, if there's a way for you to create a dashboard or something that gives to the public quickly the ability to have insight or to see these other factors that you're considering. But if that's something that you could develop, I think that would be a really helpful dashboard for the community to be able to take a look at real quickly in maybe a way that indicates to them whether we're doing good or not doing good with respect to some of these other factors that you take into account when you're deciding whether or not to make stage changes. And then the last thing I'll say before I turn it back over to you, Judge, I'm still real confused by the governor's order, GA 40 yesterday, that gives directions to private businesses about what they can do in their establishments. I mean, it just seems to me to be really anti-business and a real limitation of the freedoms and liberties for someone to say, in my own private business, just like I require people to wear shoes, or I require people some businesses can do that, some businesses cannot do that. But to say to businesses that you can't do that to protect their employees or their customers, and then let customers and employees decide if that's a place they want to work in, I just don't understand it, and it just seems to be really inconsistent with so much as I've heard in the past. and the principles espoused by the governor and the leadership. But I would still point out, as I read that, it still allows for testing mandates. Doesn't put a limitation on the ability to be able to do testing mandates, or to let people then opt out of a testing requirement because they have a vaccine. Doesn't require anyone to get a vaccine, but if someone has voluntarily chosen to get a vaccine, it enables them to opt out of a testing mandate or requirement, kind of like what we saw at ACL this past couple weekends. And my hope is that more employers and private businesses and activities will adopt that testing mandate with that entirely optional vaccination opt-out provision. And again, I want to thank everybody. I think the county strike team is doing a great job getting into the areas that we need to get into, but not just them as well. Director Stirrup, APH, is also focused on those populations as well, and you're making great headway in that too. It is way too slow, but as you said, it is not for want of effort, and there's still progress being made. With that, Judge, I'll turn it back over to you.
Thank you, Mayor. And I just have one question for you, Mayor. Why don't elephants like computers?
I'm sorry, what?
Why don't elephants like computers?
I don't know. You're a dad, though. I love daddler jokes. What's the answer?
They're afraid of the mouse.
Afraid of the mouse.
Comes from your local 5-year-old.
Well, they're definitely improving. They're definitely improving.
Thank you. Thank you, council members and commissioners and everybody, and especially thanks to APH, Dr. Walks, and to the Travis County folks, Constable Morales, Chuck, and ESD 11 for all the work that y'all are doing. We will, I guess, adjourn and Commissioner Trevelyan, 10 minutes?
10 minutes.
10 minutes? Okay, we'll come back at 10:55, and I will pass it over to you, Mayor, to do the same.
Judge, thank you. With a quorum that was established during the presentation, we're going to go ahead and adjourn also our portion of the joint meeting with the Travis County Court here on Tuesday, October 12th, 2021, also 10:45. Colleagues, 10-minute break, and then let's get together at 5 till. I didn't see any pulled items. We do have one item we're going to act on. Make sure there aren't any pulled items. We'll get into executive session because we have some things that are timely to be decided this week that need to move on.